Good morning and welcome to the Global Forum for Nicotine, Day 2. This morning we're going to be talking about the European election results, which of course European elections took place last week. So before that I will introduce myself and my fellow panellists. So I'm Rebecca Taylor, I'm a health policy specialist and a former member of the European Parliament. I was in the Liberal Renew group. And I was there at the time of the last revision of the Tobacco Products Directive. So I still bear the scars of the battle we fought to get proportionate regulation of electronic cigarettes and not regulate them out of existence, which was the desire of some of my colleagues in the European Parliament, not in the Liberal group, I hasten to add. So our panellists come from a number of European countries. We have Michael Landl from Austria, Konstantinos Farsalinos from Greece, and Fernando Bueno from Spain. So I'll now ask our panellists to briefly introduce themselves.
Yeah, hello. Thank you. I'm Michael from the World Vapers Alliance. So we are a consumer organization operating worldwide, but obviously a lot on the EU level as well. And personally, I'm from Austria and based in Vienna.
So I'm Konstantinos Farsalinos. I'm a physician by training and a researcher on public health in relation to smoking and tobacco harm reduction.
Good morning. I'm Fernando Fernandez Bueno. I'm Oncology surgeon from Spain, and I'm the speaker of a national platform of tobacco harm reduction in Spain.
Thank you. So across the 27 EU nations, we saw people vote in the European elections. And the media coverage has very much focused on the rise of the far right, although many of the parties of the far right who elected MEPs already had MEPs in the parliament. But actually, if you take a more careful look at the results, it's a bit more of a mixed bag. So the far right did make significant gains in France and also in Germany, in France mainly at the expense of President Macron. And also in other European countries, a bit of a different picture. In Italy, one of the far-right parties lost seats. In Portugal, their vote share halved. And in Sweden, also lost seats. And parties of the centre-left fared pretty well across Europe. Their group remains kind of stable. And another European trend was that Green parties lost out pretty much across the board. Although it has to be noted that they did have very, very good results in 2019. Some people argue it was a bit of a high watermark. My group, the Liberal group, did fall in size, although mainly due to losses in 2 countries, which was France, President Macron, and also Spain. And elsewhere, Liberals remained pretty stable or made gains. So now I'm going to ask the panellists their perspective from the elections in their country. And we start with Francesco.
Spain, we say always Spain is different because we have a left-hand government in Spain, but it's like a Frankenstein government because inside the government in Spain, they mix with the right. Sometimes, for example, in the north, in Catalonia, their politics about the tobacco harm reductions, they go on the politics on Europe from the left. And they don't permit some things to introduce in the public health only to speak about tobacco harm reductions. Some of our organizations, we are banned only to speak.
So bad.
Only to speak. We don't pretend to introduce some laws.
Quite a democratic approach.
Yes, that's exactly what I was thinking.
Yes, but always they say, we are democratic, we want to talk with everybody. But it's
as long as they agree with us.
Yes,
it's a typical democratic view.
The typical democratic from the left.
Exactly.
And now in Europe, the right parties win the elections in Spain, but probably happen the same with the local government. Probably the left again mix with that Frankenstein government, mixing little minoritarian parties and mixing a big group. And we don't know what is going to happen till the next year, because now it's a weak government.
Yeah. the view from Greece?
Yes. Well, in Greece, we don't have far-right parties. There was a far-right-wing party before. It was banned from the judicial system. By the way, while I've never voted for any far-right party, I'm very much against having the justice system decide who will ask to be voted by the people. We should have freedom of speech, even if we don't like what people say, and even if we are completely against them ideologically, as long as there is no violence.
Yeah, I was
so
gonna
I'm
say.
for freedom, of course.
Yeah.
I'm talking about views and opinions. I'm not
Sure.
talking about actions. Violence is about actions. It's not about having an opinion. That's my opinion. Now, in Greece, the government party, which is supposed to be a center right-wing party, it's not, in my opinion, lost quite a lot of its power, about 14% compared to the previous elections for government. I'm not talking about Euro elections.
Because they won the Greek general election.
Yes,
right?
yes,
They-
last year. We had general
exactly.
elections last year, so they lost 14% compared to their last year
Okay,
performance. But still, they had twice the power of the the opposition party. So the opposition party had something like 14-15%. The government party had 28%. So still, they are the prevailing power. Concerning harm reduction, we had a major change in the policy once the center-right-wing party got into power in 2019. So last year, they won the general elections for the second time. We had a major switch towards accepting tobacco harm reduction. The previous center-left-wing government, like the government in Spain, they were so against it that you couldn't even engage into a dialogue with them.
Yeah.
To give you an understanding of how negative they were towards harm reduction, they wanted to ban the sales of raw materials like propylene glycol, glycerol, nicotine shots, and flavorings in order for people to mix their own liquids. They wanted to ban them. They tried, but they couldn't make it. They couldn't even understand that these are raw materials that you can find everywhere, including in the pharmacies. You know, pharmacies sell PGVG because these are not e-cigarette specific ingredients.
No,
you know,
exactly.
they're available for anything else. So you can get them in bulk quantities, even in pharmacies. So I was in the parliament at the time where they were discussing this issue, and I was telling them that it's like saying that we're going to ban the sales of flour to make pizza, but we're going to allow the sales of the same flour to make bread.
Yeah.
It doesn't make sense at all. I was telling them that just next to the parliament there is a pharmacy store. You can go and buy liters of propylene glycol and glycerol. They are available there.
Yeah.
You can get them. That makes no sense. But they were so negative. It completely changed with the new government to the point that today Greece is the only European country that has a procedure where a producer of a harm reduction product can apply and provide a file with all the evidence about the product in order to get a reduced exposure claim, something that only the FDA has done.
Interesting.
Only the FDA has done that I know. And have approved the reduced exposure claim for heated tobacco products and the reduced risk claim for snus, the FDA.
Yeah.
So in Greece, they created a similar process with a committee, a scientific committee, and they have already approved reduced exposure claims for 2 heated tobacco products.
Yeah.
Concerning electronic cigarettes, no manufacturer, as far as I know, has applied in this procedure to get such a claim.
Do you think it's reasonably feasible for that to happen?
Well, with electronic cigarettes, the problem is that there are very, very few products which are, ready to use as a whole product, including the battery, the atomizer, the liquid, and so on. So the diversity of products with electronic cigarettes is much bigger because, you can have a device, you can add hundreds of liquids.
Yeah.
You can have a battery and add hundreds of atomizers on top. So I don't think that manufacturers are interested in doing that because it will be, an approval only for one specific product. It won't be of any help because they sell a large variety of products.
Yeah.
So I think that it's the nature of the product.
Would they have to do an application for each individual
product? That they need to, it's not really clarified, but I suppose that they need to provide a product that can be used as it is. Most likely a pre-filled product would fit, but even for pre-filled products, we have different nicotine concentrations, we have different flavorings. It's going to be very hard to provide evidence for each product individually. So it's more the nature of the product that prevents it from applying in this procedure, although theoretically it could happen. But we have seen that the government has completely changed the position, its stance, the new government, new since 2019, and they are very much in favor of of harm reduction products in general, not just electronic cigarettes. Now, on a European level, unfortunately, we're seeing that the left party, so basically Social Democrats, are fanatically against harm reduction.
I have experience of
Which
this.
makes no sense. They're trying to impose behaviors, what I call, in quotes, mandatory protection, but they're not doing that because by depriving people from the opportunity to use a less harmful product and by suggesting that you can just quit without using anything, without even looking at reality. After 60 years of extensive knowledge about the effects of smoking, we have 26% of the European population smoking, 1.2 billion worldwide, something like that.
Yeah.
So which is a typical case of understanding how difficult it is for people to quit.
And the evidence around smoking cessation.
Exactly.
If you look at smoking cessation services, whatever method you use, you are more successful if you have that professional support.
Yes.
Whatever method, whether you use patches, nothing, vaping. This is not disputed.
Unfortunately, and I've always said that harm reduction is a human right.
Yeah.
It's perfectly aligned with the 1986 WHO Ottawa Declaration on Health Promotion.
Yeah.
So it's that old. It's a human right. We need to provide the information and the tools for people to take matters of health into their own hands.
Yeah.
And you can't
Enable
do that
people.
by misinforming and creating misperceptions about harm reduction products and then adding restrictions, which in some cases makes it more difficult for people to find harm reduction products compared to finding and buying cigarettes.
This is the bit that I always get really annoyed about. And when the Tobacco Products Directive was going through the European Parliament before, it was a point I repeatedly made. If you over-regulate electronic cigarettes, we were talking only about electronic cigarettes at that point, then you are making it easier for people to smoke. Which we know is really bad for their health. So this was always like, why would you push someone towards or keep them on a product that we know is probably 50%, isn't it? 50% of smokers die as a direct result of their smoking. Like why? Yeah. So why would you want to push people in that direction or keep them in that direction? It never made sense to me.
Yeah, but don't forget that in Europe for many years, one of the biggest public health scandals, literally a scandal, is the ban on the sales of snus. Snus is the only harm reduction product with long-term clinical epidemiological evidence
50 years.
showing that it's almost harmless, almost, I'm not going to say it's completely harmless, but we're talking about no risk for oral cancer, no risk for lung disease, no risk for lung cancer, no elevated risk for cardiovascular disease, no added risk for stroke, compared to someone who has never smoked and has never used nicotine products, not compared to a smoker. So a product with established safety record from long-term epidemiological studies, not animal, not laboratory, not cell studies, and it's banned in Europe while tobacco cigarettes are sold legally.
Yeah.
Makes no
Yeah,
sense.
no, it doesn't.
It's not just a paradox, it's a public health scandal.
Yeah, I recently was in Germany and met with some politicians there, and the news was full with youth vaping stories,
Yeah.
and everyone freaked out. And then I looked actually at the numbers, and in Germany, under 18-year-olds, 15% are still smoking, and 1.8 are vaping. And I told all the politicians, I think you're scared about the wrong product. You need to make sure that people stop smoking, because that's the deadly.
But not only in Europe, in Mexico.
Oh, yeah.
They ban e-cigarette, but it's legal to smoke.
Yeah.
It doesn't. It never made sense to me.
To the black market, the electronic cigarettes, black market, and the tobacco combustion.
You can buy
products is
everywhere.
legal.
Yeah. It
They are
doesn't.
silly. Nobody with one only
Brain cell.
Brain cell.
One brain cell,
only
yeah.
one could understand.
Yeah. And you mentioned the Social Democrats. I would like to mention the Greens as well, where I think it's even stranger, or the logical thinking, because they always tell me they want to legalize marijuana because of the black market, which it created, but at the same time they want to ban e-cigarettes. So that makes absolutely no sense, because there they think suddenly there won't be a black market and criminals taking over, which would be the case.
This
obviously.
is an interesting generalized trend. I mean, in general, throughout the world, there is a trend of legalizing marijuana, and in most cases, we're talking about smoking marijuana. So,
Which is, if it's smoked with tobacco, that is not ideal from a health
to be honest,
perspective.
even if it's smoked without tobacco, it's also not ideal at all. But the thing is that what makes it different from smoking is that you're not going to smoke 20 joints per day.
It's an occasional
it's going to be
habit.
a more
It's an
occasional one.
habit.
But still, it's a combustion process involved. If you ask people, okay, what's the benefit of having accepting the recreational use of marijuana? And what's the harm, even of recreational use of e-cigarettes? I'm sorry, but it's going to be significantly less harmful for people to vape instead of use marijuana. Don't forget that marijuana affects cognitive function in a negative way.
And particularly in young people,
it's
I think
not
there are
ideal
concerns
to drive
around that.
under the influence of marijuana. With e-cigarettes, there is no problem. With nicotine in general, there is no problem driving or doing any kind of sensitive.
The same as driving after 3 espressos, right? I mean, you're a little bit jittery.
You
Maybe
may
it's
be a
not
bit
ideal.
nervous, but it's not going to affect your performance and your concentration.
No.
Probably improve your concentration, to be honest. But it's not. So that creates a lot of paradox, because in most cases we're seeing a moralistic approach in this matter. You know, it's addiction. We don't want people to be addicted, but no one talks about caffeine, for example.
No.
And of course,
I don't get my morning cup of
so,
tea.
you know. But rightly so, because if something which creates some dependence does not cause harm, disease or death, it's a matter of people's decision, as long as they make informed decisions, of course. Imposing behaviors is something that I hate. Forcing behaviors and creating an environment of, as I said, in an exaggerated way, mandatory protection is against human dignity. It's also insulting to people's intelligence.
Taking people's agency away. Like with a slightly different thing like alcohol. I'm massively in favour of alcohol health labelling. Because if people then decide, okay,
informed decision.
Alcohol increases your risk of cancer, which it does. As long as people know that and they're making an informed decision, that's fine. But a lot of people don't know that right now. So we have no health
unlike
labelling of
cigarettes,
alcohol,
where everyone knows about the harms, but still they smoke. And at the same time, we're seeing the
although most smokers want to give up.
Yes. And, you know, they know, all of them now, today, after so many decades, everyone knows the harms of smoking, even smokers themselves. They just try to think, they don't believe it in reality, but they try to think that it's not going to be them who will be affected, but others.
It's also the discounted future thing, isn't it? Because if you're smoking at 22, you're not getting a health impact. You're getting a health impact at 45.
Plus, additionally, even smokers are completely misinformed about the actual risks of alternative products.
I mean, we saw
that 74%, I think that it's same or more harmful.
Sometimes they say it's worse.
And then you have...
There's nothing worse
there's
than...
no evidence.
And then you have like a country like Brazil, there it was 90% of smokers, which basically all smokers are completely misinformed in Brazil about the actual risks. And obviously this moralistic approach plus misinformation is a deadly combination of smokers keeping smoking.
So the European Parliament is possibly due to review the Tobacco Products Directive again. I won't be in the Parliament. I did not stand this time. I am still an EU citizen, so I could have done, but I don't live in an EU country. So first of all, I don't know, I haven't really looked into this, if this will be a priority, but I know from the perspective of at least the centre-left and some others, there is a focus on inequalities. Like we need to be doing things, we need to be doing things that are helping people, tackling the cost of living crisis, and there's a whole plethora of things to do there. So will the Tobacco Products Directive be a priority in that kind of agenda? And if it is, for me, vaping definitely fits into health inequalities because it often reaches those population groups who would, for example, never go to their local stop smoking service.
I have a word about this concern about the low socioeconomic class and about inequalities, and the word is hypocrisy, unfortunately. It's hypocrisy. Why? Because we know that it's the lower socioeconomic class that mostly smokes today, I mean for many years now.
Yeah.
And what we are doing is we are increasing the cost of smoking, which up to a point is the right way to follow, but it's punishing financially the lower socioeconomic class, and at the same time, we try to prevent them from using harm reduction products, which at least in Europe, they cost less than smoking.
Yeah.
They are, of course, by far less harmful, but cost is also an incentive for someone to try to make a switch to a less harmful alternative. But now they want to deprive, and the main discussion for TPD is to ban flavors. There is so much evidence that adult smokers use flavors, non-tobacco flavors, in order to quit. There is evidence that non-tobacco flavors increase the chance of quitting smoking compared to the use of tobacco flavors. We are seeing that even if people quit smoking by switching to vaping with tobacco flavors, they very rapidly transition to non-tobacco flavors in order to stay away from the experience of cigarettes, and that most likely, we don't have enough research for it yet, will reduce the chance of relapsing. Still, they are obsessed with the fact that chocolate flavor is about kids. It's to promote it to kids. And tell me, do you know any adult who doesn't like to eat or drink chocolate? I'm not aware of anyone.
I'm not a vapor, but I'm a chocolate fan.
My mother is 75 years old and she's vaping raspberry, blueberry, peach, and cappuccino flavors.
I didn't know there was a cappuccino flavor.
Oh, yeah. That was the first one she tried.
Okay.
And she was a 50 years menthol smoker. She's not using menthol now.
Yeah.
But just to give you an understanding that even the elderly population, they like to use flavors. No one likes to eat or drink something which is flavorless, bland, or tastes bad.
Yeah.
What I'm really impressed about, and it's a naive approach, is that there are many regulatory authorities who say that we need to make the e-cigarette not a product that people enjoy. But if a smoker won't enjoy using an e-cigarette or another harm reduction product, they just won't be able to quit.
I mean, it's part of the appeal.
Yes, exactly.
Because I mean, I know people who smoked for 20-odd years. They gave up and they vape like lemon. Or mint, or even a lemon mint, I think.
Me too, I vape a lot of lemon. I like it.
I mean,
I think there is an issue around, certainly in the UK, some of the marketing, which is clearly not aimed at adults. But that's not about flavours, that's about marketing.
The problem that I have witnessed, mainly coming from the US, is labeling packaging.
Yeah.
You see things like adding cartoons or things that may be kid-friendly. And to be honest, when I was in a conference in Germany, where some MPs, German MPs, members of the Bundestag, were there, I told them, if you want to apply some regulation to prevent youth use, you can apply it through labeling packaging. to avoid
this is what
some
we're trying to do in the-
kid-friendly
this is what we're trying to do in the
designs.
UK. Yeah,
but
exactly.
flavors, it's a very different story.
Yeah.
Yeah.
No, I would agree on that one.
And we tried to prove that, I think 2 years ago, to politicians in the Netherlands when they started to discuss the flavor ban, and we gave out flavorless ice cream in front of the parliament and then asked the
good trick.
politicians, see, flavors matter for ice cream, and the same applies to vaping. We need that. Unfortunately,
That's a
they
good
followed.
tactic.
Yeah,
That's a good
unfortunately, they didn't
tactic.
listen and follow through with the flavor ban.
Okay.
And I mean,
Yeah.
with TPD, obviously, it's a bit hard to say yet when we don't know the new commission if
No.
it's a high priority. But
Yeah.
what Politico yesterday reported is actually that the council, so the member states, Denmark and Latvia are pushing a flavor ban already to do it
Okay.
without TPD review.
In Spain.
And Spain, yeah.
Yes,
And so that is next
the
week.
press
So
release says there's, I think, almost 8 countries.
Yes.
Okay.
They're going to.
They sent a letter to the European
But
Commission
because-
about flavors.
Because I think they have to focus in one thing that people don't understand. If you say flavors, youth, people, kids,
It's emotional.
and people quickly mix and say,
Okay. We've got, carry on. We've got like 1 minute to wrap up.
No, and then I think they have to focus, because if they focus in science, they lose. the fight.
Yes, absolutely.
You have to focus in something you cannot prove. Flavors are bad.
That
They are
sound
going to
and
introduce.
Emotional.
the overall
Yes,
message
yes.
sounds
Emotional
really bad.
argument.
Like, oh no, we must
Yes.
protect children.
But here
Yeah.
we talk about science
Yeah.
in this congress.
Yeah.
And science is for us, it's good. But sometimes you try to speak with science, with data, and they say, no. Cochrane in Spain, I have heard some pneumologists telling Cochrane is
Yeah.
not
Cochrane
so
reviews.
good.
Yeah.
Cochrane
Well,
is worthwhile.
because they came up
In
with the
Greece,
wrong
I've heard
results.
Yes,
from
because the data.
We're going to run out. Listen, we're
a
going to run out of
physician
time very shortly.
said in Greece that in a conference when we had a debate pro and against the cigarettes, that Public Health England has been funded by the tobacco industry.
Yeah.
That's what they have.
That's
what I
hilarious.
heard.
That's absolutely hilarious.
Really.
Okay, so I'd like to thank my panelists, Fernando, Konstantinos, and Michael. Hopefully, that was a bit of an interesting take on the European Parliament elections, and a little bit broader than some of the newspaper headlines. So we'll see what happens once the new commission is established and we see who ends up president of the commission, which may or may not be the current incumbent. So thank you for watching, and I hope that was interesting for you.